Hi, I'm Dr. Raj Sundar, a family physician and a community organizer. You're listening to Healthcare for Humans, the show dedicated to educating you on how to care for culturally diverse communities so you can be a better healer. This is about everything that you wish you knew to really care for the person in front of you, not just a body system. Let's learn together. Okay, here's the last installment from the health conference. And this one I really like, because I hear this a lot. When some of my patients retire, they stop leaving the house. Not all at once. First, the morning walks disappeared. Then the phone calls to old colleagues. They would talk about their days. They sit in the same chair for hours, staring at news. And I mean news, especially these days. They weren't really watching. When I asked how they were doing, they would say fine. Always fine. For some of my patients, they grew up in a culture where men don't talk about their feelings, where asking for help means you've failed, like really failed at something, and where therapy is for people with quote unquote real problems, not someone who just feels empty. I didn't have the language for it then. Maybe I have it a little more now, that he had lost a sense of purpose and nobody in his care team was asking about it. I met
Neelam,
founder of Total Life, a company focused on mental health care for older adults, at the health conference. She started it after watching her mother spiral into depression following a major surgery. 3 hospital admissions before anyone mentioned mental health support. When she finally asked the nurses why mental health wasn't part of the discharge plan, the answer seemed simple: resources. It's just not part of how we do things. And that answer should haunt all of us, because not part of how we do things falls hardest on communities already navigating barriers: language, culture, immigration status, distrust of systems that have failed them before. And you may know this if you're providing care or you're part of the healthcare system. 2/3 of behavioral health professionals don't accept Medicare. And if you're an elder who needs a therapist who speaks your language, understands your faith, the wait isn't just 6 months. It's often forever. So in this conversation, I talk about how to rethink how we care for aging parents, especially those from communities whose mental health carries stigma, where therapy feels foreign, and where the very concept of sitting with a stranger and discussing feelings contradicts everything you were raised to believe. And that might be true for me too. You'll also meet Lily, their AI care agent, and this is the intersection of technology here, who calls between sessions, helps patients stick to their care plan, and trains the muscle memory of new habits. I'm not sure how I feel about AI right now. I know it has tremendous potential. I know it's making real change in our lives right now. And I'm uncertain about what it will look like in the future. But technology like this does exist. And imagine if Lily, this AI care agent, can extend the reach of a Spanish-speaking therapist. If she can check in daily with an isolated elder, if she can bridge the gaps between sessions for someone who would otherwise fall through the cracks. That's really technology raising the floor, something we've talked about before.
Neelam,
Also ends with one specific question. So this year, when you sit with your parents, ask how they're really doing. Because they won't want to burden you. They'll say they're fine. And sometimes fine is one of the loneliest words in the language. Here's
Neelam,
talking about what Total Life is doing.
it's so great to see you here.
Thank you.
I saw you on stage and I immediately thought I have to have her on the podcast.
It was so good to be included on day one of the health agenda to talk about aging, loneliness, AI, and what's going to happen for mom and dad in this world. Because I remember my first health, nobody was speaking about silver tech or the last third of life, which is really ironic because most of healthcare dollars are spent in the last third of life.
Yeah, so true. I want to hear your story of when did you realize this is what I'm going to dedicate my life to?
I like solving white space problems where, nobody's really thinking or acting. And I feel age tech and senior care is something that has so much opportunity to do better. We can order anything to our door right now with Uber. But when you think about the care that mom and dad need as they age, the services, the technologies, they're really nascent still. A lot of them look like they were designed in 1999. And if we want to be with healthy parents who age well and age independently, then we need to improve the services and technologies that are going to them. I like the aging space for that reason. But what prompted Total Life is a personal experience. I was at home during COVID, as most of us in New York left. And mom actually ended up having a scare, and they ended up needing to do a major surgery to diagnose everything, which really changed the quality of her life. She became extremely withdrawn and depressed. And after the third readmission, I, started talking to all the nurses and figuring out, you guys got to do more for her. She's not doing well. And that's when we talked about psych intervention. And I remember thinking, why didn't you guys do this in the first place? Why wasn't that part of the care plan? At discharge, we would have been much better off as an entire family, right? And that's when I started going back, and the nurse even said to me, the reason is resources, and it's just not part of care plans usually at discharge. And when I looked back at the research that night, as any inquisitive mind does, I went home and Googled it. And I was like, wait, this is crazy, right? We're mental health, it was being spoken about so much during COVID, but not for seniors. And to me, I was with my parents who are aging and dealing with so many different roadblocks and challenges, physical changes in their families. And I was like, well, who's there for them? And do they even know that they have support? And I started looking at, is there an opportunity to do better? And that's why Total Life was born.
Yeah, amazing. Did you feel intimidated going into this space? Because I hear so much about Medicare and its poor coverage for mental health providers, which is part of the bottleneck. I'm a primary care physician it's hard to find therapists. And I don't know when you realized that and you were like, I'm going to figure out a way. And I'm curious on how that journey has evolved as you're working through the different barriers for getting the mental health support.
I think it comes back to I remember reading a statistic that 2/3 of behavioral health professionals don't accept Medicare, which is why actually 80% of seniors don't get access. Less than 6% get timely interventions. Less than 6%. And layer that or compare that to the fact that some health systems that we're working with are seeing a 50% diagnosis of depression in their population. 1 in 2 people, which is much higher than what even SAMHSA reports. Right? SAMHSA is saying 1 in 4. It's 1 in 2. At different stages of aging, it's tough not to have some level of anxiety. So the reality is it's not an easy market. Mental health practitioners don't want to take Medicare because it's complicated. If you're a small provider group, there's a lot of administration to bill and work with Medicare, and sometimes lack of clarity. And it's not easy, but that's where I think there's an opportunity, right? If now that we're larger, we go to DC, we get to hear from the horse's mouth what's really going on. If you improve mental health, you improve health. It's not the other way around. Our mind, our feelings, our actions, these all have a significant impact on how we age.
I think of how we've maybe falsely separated out mind and body. It's so integrated, right?
You hear about those stories, or if one elder dies, the spouse passes away soon after. That's the mental health side. It wasn't something that they had physical decline, right? They weren't happy anymore. So the joy and the purpose and that resilience starts with your mind. It starts with your thoughts, feelings.
Yeah. Mental health, there's anxiety, depression, but a core part of that is social isolation. I would love to hear the model of care for Total Life, of what you provide and how we go about addressing social isolation.
So today, our ideal model of care is when an elder is in a primary care office and they're doing their annual wellness visit. Every doctor, according to Medicare now, should be doing a PHQ-9 or mental health assessment. And once there is indication of some challenge on the mental health side, whether it's a higher PHQ-9 score, or do they look the same? Are they taking care of themselves? Are they saying words like, what's the point? I don't care, whatever. These are telltale signs that the person's not happy, right? And they're struggling. And so if a doctor notices that, I think it's incumbent on the doctor to talk about therapy. I don't think it's happening enough. And as you said, it might be because there's no resources, but we certainly exist and we are there to capture that patient and support them and give them timely interventions, like no long wait lists. We're able to see patients within 7 days. And typically, once we receive a referral from a doctor's office, we're calling the patient before they've left the office, right? We're very much involved. And the goal is to really be a partner to primary care and close the loop on care, because it's a care team that takes care of mom and dad, right? There's a lot of things happening as we age. The more we can be cooperative and integrated, it's better for the patient. That's one model. The second is that patients find out about us through the word of mouth, online research, and they can sign up directly. So if they go to the website and sign up, they don't need a referral. We verify insurance so that we can give you guidance on your coverage, and you can start doing sessions directly. Nobody needs to know. You don't have to tell your doctor if you don't want to. And you can do it from the comfort and privacy of home. No transportation needed. That's really convenient, especially for folks that have never tried it before. You can be in a safe spot and try something new.
Yeah. And seniors come from all different cultures. So how do you match to cultural and language concordance? Because that's such a barrier for therapy for, I feel like, any age. But as I feel like some elders that I take care of, it's an additional barrier of, will they understand me? And will they know and get it?
Yeah, I think there is a lot of cultural sensitivity that has a role in mental health. It's tough to have enough supply and demand at all times, but we're certainly trying our best to build it. We've got folks that speak multiple different languages on the roster, different religions, different sexual orientations. Like, we're trying to build the most diverse roster, different ages. You know, our oldest therapist on the roster is like 80. Oh. So we have a whole range. Good. He came out of retirement. He's enjoying it so much. I think there's something cathartic about working with your age group too.
You did?
And I personally don't believe in retirement. I think if you love what you do, it keeps your mind active, and it's okay to make your life easier. But to say I'm not going to work, I think is not good for your mind. Your mind needs to stay engaged. And so I think everybody should have a plan before they retire. Retiring and just sitting at home is not a plan.
I know what you're going to do. You're not going to retire. I can already tell.
Yeah, I'll be working until the end. I'll change what I do. I think the curiosity of exploring a brand new industry and figuring out how to improve it is thrilling. And we're doing that now in healthcare.
You're talking like a founder. What about this AI thing that talks about, and intelligent AI, you walk through booths, you have no idea what they're doing, but you have something concrete and tangible that you talked about to deliver care for your patients. Tell me a little bit more about that.
Yeah, we're really excited. We are piloting Lily in multiple instances. The goal for Lily is to engage the patient and be your care agent, your care coordinator between sessions, helping you book, schedule, and adhere to your care plans. So when we talk about adherence, if you're working with a therapist and your therapist is saying, it's really important you move a little bit more, try to eat differently, or when something negative happens, change your thoughts patterns, and that will change your outcomes. But it's easy in the moment to say, yeah, I got it. But then a couple of days go by and you fall back into your patterns. So Lily's goal will be to call you every day or as often as you'd like and help train that muscle memory to change your behaviors. Give you microdoses of interventions that are evidence-based, but in a friendly tone, supportive, and as realistic and personal as possible. Our goal is not to replace the clinician. Our goal is to expand the clinical support.
Yeah. And do you feel like seniors have been open to this? And how has the pilot been going?
Extremely well. Even when we started 3 years ago, we would text people, hey, it's Lily, your appointment's scheduled for 5 p.m. on Friday. You're like, thanks, Lily. It's very clearly not AI, but I think people want to believe, or it's nice to just put a name to. So I knew from 4 years ago that the AI will work. And so about 8 months ago, we started calling people to remind them of their appointments, and we were using AI. And folks were talking to, yep, I'm ready for my appointment. I'll just be there right away. Just give me 10 minutes. And I'm like, okay. And so it's a very simple use case, but people were conversing with it, even though it sounded like a bot. So I was like, interesting. Now Lily sounds pretty with technology improving really fast over the past year. So Lily sounds human and she can call you. She remembers what you said yesterday. We're going to launch a version of Lily that helps you write memoirs. So memory and engagement. If you tell Lily stories, she'll slowly write them down and eventually we can turn that into a book for you to give to your
That's awesome.
kids.
Yeah.
There's so much we can do with Lily. Our goal is to really be productive and use Lily to improve your habits, thoughts, and actions.
Yeah. What is in 5 years, if you feel like you've achieved everything you wanted, where do you imagine total life to be?
Wow, that's
You can
a great
that's like
question.
this podcast. I can cut whatever you want. Take your time.
I'm doing this because I care. I really want to see the company be a household brand. If you're sitting at a dinner table and you see mom or dad struggling, you're calling Total Life a trusted, reliable partner to support mom and dad's aging journey. When I was going through this, Mom, I didn't know who to call. And like you said, there's all these cultural nuances to what therapist was I going to trust? Like, is there a company that's focused on elder care? We're constantly growing and we listen to feedback, we iterate, but there's a lot of opportunity to do better by the people that gave us life.
Yeah. Do you find that some people want in-person care? And how do you navigate that with a virtual only model? I find there's two barriers that I often hear about. One is that sometimes people want in person. And then I don't know if there's a way to do a warm handoff there. And two was the insurance piece of it. I know we touched upon it a little bit, but if people are uninsured or Medicare they don't have supplemental insurance, so the cost is really high. Of how do you make it accessible for everybody?
There are folks sometimes that will call in and say rather find somebody in person, but often they call back. It's hard to find somebody in person, especially if you think about our aging population are the ones in rural areas. And even if they're in an urban center, like distance matters, right? You don't want to drive far. You don't want to wait too long. Parking is not easy. And so there's just so many conveniences of online. But the biggest convenience is it's available, right? If you look in person in most metro cities, like if you're looking for a therapist who accepts Medicare, you're looking at long wait times. New York Times did an article saying it was about 9 months, 6 to 9 months in New York.
Wow.
So it's not easy to find. And so I do believe some therapy is better than no therapy because just the idea of having an impartial, trained person helping you navigate your feelings is so valuable. I also think there is stigma with the older population around therapy, and where we can improve that is at kids talking to their parents. I remember asking my dad, would you consider it? Because he was not doing well post-retirement. He lost his sense of purpose and sense of self. And I said, therapy is there to help you reframe what the next 30 years look like. It's like a coach. It's not because you have issues. And when I framed it that way, he was open to it. And so I do think we have a responsibility as kids to have that conversation at home with mom and dad. Insurance, Medicare is pretty good at coverage on mental health. Original Medicare, that is, with most people have a Medigap plan.
Yeah.
So a lot of our patients don't pay anything out of pocket once their deductibles are met. So that really reduces the barrier to care. Medicare Advantage plans, some are at parity with Medicare, others have copays. Even a $30 or $40 copay can sometimes be a deterrent, which makes us really sad that that's the case because it's short-sighted on the part of a Medicare Advantage plan to have copays. Some plans are now starting to waive them for mental health, and I think that's the right decision, and I hope we continue to see that sort of evolution. Nobody wants to see a therapist if they don't need it, right? There's this idea that overutilization will occur if you remove the copay. I fundamentally disagree with, right? People want to feel better. Right.
No.
And I honestly think we can have Lily doing the often check-ins and let the therapist just do really the foundational work with the patient.
Yeah. From a equity standpoint, have you noticed certain communities being more skeptical of AI-based intervention, specifically for mental health? And is there a way to address that? I just find people still aren't sure what to make of AI. There's some distrust in some places. If you're having Lily, however you design it, try to support their care. How do people trust this thing that they haven't heard about before?
Yeah. I think a year ago, there was a lot of distrust. It's interesting how quickly everybody's adoption curve has moved, right? Even if you look at health today, every company has an AI something. And so I do think this is inevitable. I think we waited until the technology became really good to really think about how Lily will work and interact with patients. We always knew there's a use case. I don't think Lily, never say never, but I don't think Lily will do therapy ever. I don't believe in replacing the human. I believe in like adding more resources to that clinical interaction. And Lily will always be that resource to support the clinical interaction. I think there's very much, we're human. We need to speak to other humans. I think there's very much a need for it. But what it does do is expand access, right? So if otherwise would have done 12 sessions or 6 sessions with therapists, maybe you do 3 and they're spread out longer and Lily's in the middle and the therapist is able to see some of that note-taking and progress. And if the progress is halting, the therapist gets back involved. So I think escalating to a therapist is important, which is why I'm happy for the last 3 years we built this clinical rostering capability, because now adding AI is easy on top. I am a bit wary of companies that are AI only. I don't think that's a good solution.
Yeah, I agree. Any final thoughts about what you're building and what you want people to know?
Look, I want people to know that mom and dad sometimes need help too. And if you see mom or dad struggling and you're not able to be there for them, and even if you are, like, sometimes they're not sharing everything with you, right? They don't want to stress their kids out, right? And
they don't want to burden their kids. Yeah,
exactly.
Yeah.
And so I think like just taking that minute later this month during Thanksgiving and asking them how they're doing, reading between the lines, and letting them know that like you can sign them up and talk to them about Total Life, talk to them about therapy. Just mental health matters. It really does. If you want to have your parents around for a long time like I do, you got to make sure they're joyful, they're living with purpose, they're active, engaged in community, and they're like happy.
Amazing. It's so great to have you again for joining us.
Thank you.
As always, thank you for listening to Healthcare for Humans. If you've found any value in this podcast, I have 2 quick requests. 1, please leave a review in the podcast app that you're listening to my voice in right now. It really helps others discover the show. 2, share this episode with anyone who you think might benefit from it. For easy access to all our episodes and to support the podcast, visit www.healthcareforhumans.org. There you'll find our content clearly organized by topics, countries, themes, to help you choose what to listen to next. Until next time, this is Dr. Raj Sundar, reminding you that culturally responsive care leads to better patient outcomes. See you again soon.